Joining me today is Steve Norton, who's the Executive Director of the New Hampshire Center for Public Policy Studies. Steve, healthcare. It's certainly going to be a big issue in, I think, this upcoming election cycle for New Hampshire. I think the opioid crisis has sort of brought some of the dynamics to the front. But if that still weren't there, this is a major issue that we're struggling with.
Yep.
Could you unpack some of the central features we ought to look at when we're thinking about healthcare in New Hampshire?
Yep. The first thing you have to remember is that healthcare is the second largest industry in the state behind manufacturing. So hospitals, physicians, other healthcare providers are a very big part of our economy. We have 24 hospitals that are nonprofit organizations that are cornerstone businesses in many communities across the state. So it's a very important, not only for the health of the state, but also economically very important, and has it's throughout all of our communities.
And it's going to be more important as we go back to as we age. Mm-hmm. I mean, the one thing I've noticed is I need more care as I get older.
That's right. Absolutely. The second thing to note is, of course, the Affordable Care Act really changed the fundamentals of market dynamics. It encourages organizations to consolidate, particularly hospitals trying to build out systems that are going to support population health. And that has really started almost a wild, wild west feel of consolidation and merger and affiliation conversations among these healthcare providers.
Well, and a lot of our coverage area is driven by Dartmouth Hitchcock, and their partnerships with Alice Peck Day, New London Hospital. I mean, in Claremont, we're seeing it. We see that. And that's what you're talking about.
That is exactly right, and that's what's happening in the northwestern part of the state, and in the southeastern part of the state. What you're seeing is really a question about the affiliation or relationship between the Massachusetts tertiary care and quaternary care organizations like Mass General Hospital and the Elliots and the Southern hospitals down there. But it's a really intense conversations going on now.
Now, but at the same time, one of the backdrop has got to be the reimbursement rate from the federal government. Mm-hmm. People I talk to say the federal government doesn't reimburse at the true cost level for some patients.
That's right. Right now, I think if you asked a hospital executive, they'd say it reimburses about 80% of their expenses for a particular patient. And the question is really going forward for these organizations, whether it's Dartmouth or New London or any hospital in the state, is can you survive on Medicare payment rates, which are 80% of what your expenses are? There are two ways of solving this equation. One is by increasing rates, which I don't think is going to happen.
Which, if Medicare sets the rate, the market can't set the rate.
That's correct. Then I think what's going to happen is hospitals are going to have to lower their expenses in some fashion.
I'm stumped here on this because I don't see how. I mean, what I've noticed, the inflation in healthcare has been equal to or outpaced the inflation in higher ed, which is significantly above the inflation rate of the country.
Right.
So CPI for healthcare is going up. How are they going to rein that in?
Well, they're finding ways. And back in the 90s and 2000s, hospital expenses were growing at 8 or 10% per year. Over the last 5 or 6 years, it's been 2% per year.
So they are finding ways
to control those costs. And I think that conversations about consolidation and mergers are at least in part about trying to find ways to lower costs, or at least that's what the stated goal is. And also, increasing the coordination of care, putting people into the systems where they'll get the best care. Whether or not that will actually lower costs, we'll have to see down the road.
So what's one thing somebody ought to be thinking about who's a legislature? They're going to have to deal with this issue in this next biennium.
Yep.
What's the one thing you'd want them? What's one study you'd want them to point out?
One of the things that we don't have in the state right now going forward is a monitoring system for what's happening to these systems, healthcare systems. And imagine there are 24 community charitable trusts They're nonprofit organizations. And we don't have any system for understanding how the community benefit that's being provided is changing or how those organizations are changing. And I think from a legislative perspective, we want to understand what's happening to those trusts and our healthcare that's in our state.
All right, I got to leave it there, but we're going to have you back again. Thanks so much for being here.
Thank you.
And thank you for joining us for this edition of Capital Connections, your weekly access to politics and policy along the I-89 and I-91 corridors and how it impacts your life in our region. If you've got a comment or an idea for a future show, why don't you send me an email? But in the meantime, please join us again at the same time next week for another edition of Capital Connections.